Hello everybody, this is Dr. Kuo. Joining me here is Dr. Bek. Today, we will be taking turns asking each other questions and discussing the fundamentals of shockwave technology and its application in erectile dysfunction. Welcome, Dr. Bek. Why don't we start with you telling us a little bit about yourself and how you came to where we are today?
Sure. So hi everybody, this is Dr. Bek and thank you for having me here, Dr. Kuo. So I was originally trained in emergency medicine and it was very intense and fast-paced environment which got me burned out after a few years. Then after that, with the friend's recommendation, I had the opportunity to transition into men's health field. And since then, it was 2019, I believe. So I have worked with the clients who struggle with their sex life, and we were using a shockwave technology. And then I saw the benefits of the shockwave therapy and its untapped potential for greater achievements, especially in sexual medicine. Shockwave therapy was able to help young and old clients who struggle with their sex life. But before we talk about deep into shockwave therapy, and let's back up and start with the basic, Dr. Kuo. What is ED and what causes it?
ED is the most common type of sexual dysfunction in men. It happens to a lot of guys. A 2018 paper estimates ED affecting about a third of men. ED stands for erectile dysfunction, and it's any condition that results in consistent or recurrent inability to get an erection or maintain an erection that is sufficiently rigid for sex. There are many causes for ED. Generally, we can look at this issue from a few perspectives: vascular, neurologic, local penile factor, hormonal, drug-induced, and psychogenic. Some examples include cardiovascular disease, diabetes, hypertension, overweight, high cholesterol, smoking, even certain medication use, as well as anxiety and depression. In some cases, even porn addiction may be related to increased chances of ED.
That makes sense. So what are the treatment options for ED, Dr. Kuo?
Treatment for ED needs to reflect an individual's cause of ED. For example, you wouldn't want to treat someone with ED of vascular origin, meaning that's a blood supply issue, with psychogenic treatments because it's simply not effective and would be considered unethical and could cause harm, right? With that said, some people with ED actually have few issues contributing to their problems. Some people may have neglected their health for quite some time. Multiple health conditions can accumulate and all show up at once, which only makes their condition even harder to treat. However, for the sake of keeping this topic more straightforward, let's talk about the most common standard treatment options and how they can be helpful. First, the blue pill. Some brand names of this class of medications are Viagra, Cialis, Levitra, and etc. This particular class of medication is called PDE5 inhibitors. They essentially manually open the blood supply to the penile tissue and effectively induce an erection. Second, very similar to PDE5 inhibitors, an actual vacuum pump that can create a negative pressure which forces all the blood to the penile tissue and induce an erection. The erection is maintained with an elastic ring at the base of the penis to prevent any blood from escaping. Third, if someone has hormonal imbalance or have low testosterone, that might lead to a lack of sex drive. Proper plan of action includes hormonal testing and restoring optimal levels, sometimes through combination of prescriptions or lifestyle recommendations. Fourth, if oral form of medication doesn't work or have other side effects, intraurethral therapy or penile injections can be two other options as well. Lastly, surgery is also an option for those who have failed oral, insertional, and injectable therapies. Now that I've touched up on the basics of ED and their traditional treatments, other newer clinical approaches include shockwave therapy, PRP, or stem cell injections. Now, pertaining to our topics today, Dr. Bek, what is shockwave therapy?
So let's start with the history of the shockwave technology. It was first used to treat kidney stones in mid-1980s in the United States without any cut or incisions. After that, it completely revolutionized kidney stone treatments. But this was very early form of the technology, and it uses very high energy of the sound waves. Since then, using much lower energy of the sound waves, orthopedic surgeons found that shockwave could reduce the inflammation in the muscle and joint. In early 2000s, cardiologists studying shockwave therapy for its ability to regenerate blood vessels. After all, the majority of the ED is caused by the problems with the blood vessels, although there are other reasons you mentioned earlier. Shockwave is a non-invasive technology that delivers the sound waves to the affected areas of the body. In our cases, it's going to be perineum or penis shaft itself. It can cause micro damage that can ideally ignite the body's natural healing process. It can also stimulate new blood vessels formation. It's called angiogenesis. Also, it breaks down the plaques inside the blood vessels for better blood flow. So there are two types of the shockwave therapy used for treating ED called radial and focused. Focused shockwave releases higher energy density waves than the radial devices, which means it can travel deeper into the body that reach the area we want to treat. For example, radial shockwave can reach only 3 to 4 centimeters into the body versus focused shockwave technology which gets up to 10 to 12 centimeters deep into the body. There are certain areas where focused machine work better, or in other areas the radial machine works better.
Thanks for touching up on the different types of waves. So why is shockwave therapy one of the best options for ED?
So first of all, shockwave therapy is non-invasive and has virtually no side effects. Unlike some other traditional treatments outlined by you, which more or less they all have side effects. Shockwave therapy is well tolerated without any discomfort. It's fast and efficient. Each treatment takes only 15 to 20 minutes. Most importantly, there is high chance of success rate and long-term result with the shockwave therapy. Not only is therapy better for health, in the long run, it will ultimately help you save more from the cost and other complications from the traditional treatments. So Dr. Kwok, who qualifies for shockwave therapy?
Yeah, basically anyone who wants to improve their sexual health and sexual performance qualifies for this treatment. It can benefit young or old folks and even adult content creators as well. It may be easier to say who doesn't qualify for this. Anyone under 18 years of age, those who are taking high doses of blood thinner, those who have malignant tumors, and someone who has lost penile sensation completely after surgery of prostate cancer. With all this said, why come to New Health Medical Center for this treatment? At New Health Medical Center, we pride ourselves in going above and beyond, offering the best services to our clients. Our approach is always holistic, and we take the time to discover the underlying issue rather than giving you a Band-Aid. Given the benefits of both radial and focused shockwave, we aim to help patients achieve best results by using both technologies in the same visit. Furthermore, we pay attention to proper intensity and pulse use per treatment cycle to ensure maximum efficacy. That about sums up all the ins and outs of shockwave therapy. Do you have more questions about ED or shockwave therapy or how we can help? We invite you to make a complimentary appointment so we can further address your questions and concerns, or you may leave a comment down below. Until next time, this is Dr. Kuo and Dr. Bek from New Health Medical Center. Bye-bye.